Hi, I'm Rachel Abbasi. Welcome to the Recovery Daily Podcast. As always, thanks for spending time with me. Hello, welcome back. And today I wanted to talk about something that comes up a lot in my sobriety. And I thought that might be a good topic. It's about whether one changes their goals to meet their behavior or changes their behavior to meet their goals. And this is something that was introduced to me in sobriety. And so now when I think about it, it intrigues me even more when I think about it with respect to stroke recovery. And I think that it's because in stroke recovery, in vestibular recovery, as I call it, um, we deal with so much unknown, so much fatigue and chronic pain. And um, every day we wake up, we don't know, is it going to be a good day or is it a bad day? Am I going to be able to do things? Am I going to do things that go towards my goal, or am I not? Or am I, and here's the trick question that I always face, am I just being lazy? Um, and if I face that question, that internal question all the time, I can't be the only one. So, who's in charge of my day? Is it my behavior or my goals? Um, am I willing to do what I don't feel like doing in order to reach my goal? Or on a day-to-day basis, am I picking and choosing what I want to do based on my goals or based on being lazy? Is it based on being fatigued and in pain, or is it being lazy? I'm telling you that this is like the million-dollar question for me in recovery. And I know that prior to sobriety, like this is a lifelong internal question. Am I being lazy? Or am I actually tired? What is going on? So, how do I know if I'm lowering my goals to match my behavior or I'm raising my behavior to meet my goals? Because I know I'm just kind of rattling this off, but in recovery, in stroke recovery, vestibular recovery, my goals do have to move. They do. They have to move according to, like, maybe the goal that I set for myself isn't realistic. You all know that I'm a very, like, overachiever, self-proclaimed overachiever. And I have paint on my arm. Um, am I setting my goals based on what's realistic for me? And on a daily basis, am I thinking this is enough? Like, okay, I'm just going to do this much. This is enough. It's enough for what? Is it enough progress towards my goal? Is it enough because I just can't do anymore because I'm tired? Um, am I protecting my comfort? Am I pro you see what I'm saying? Like those of you who are in dealing with chronic pain and dealing with a vestibular disorder, I feel like this would resonate most to you, with you, but maybe others, maybe everyone has a taste of this. I would think so. Is the comfort that I'm retreating to? Is that comfort because I don't like getting uncomfortable? Or am I avoiding the discomfort of growth? You know, it's so confusing to be inside Rachel's brain. It's it's hard to know what is happening. Like, what is my honest path? Um, so I think that's what it comes down to is always being self-aware, like working on that self-awareness, working on like pausing and thinking, um, what is really happening? So here's an example, kind of. I should prepare examples before I hit record, but I don't do that. I like to talk off the cuff, so I don't do that. But um, I was thinking before I started recording, I was thinking, I don't feel like making dinner tonight. And then I thought, Boris, don't lick Autumn. Thank you. Thank you. Excuse him. So, I was thinking, I don't feel like making dinner. And then I thought, oh, I don't have to make dinner because our dishwasher is busted. So we decided to have frozen meals this week. And I thought, oh, I'm happy. I don't have to make dinner. Or, I mean, I never have to, but I don't have that like feeling that I need to, I guess. And I thought, this is laziness. That's what that is. Because I just finished painting for about I think I was painting for about an hour or so, which is pretty good for me. I don't usually last that long. So I'm feeling okay that I was able to do that. Painting like takes a lot of mental energy for me, a lot of visual energy because I'm looking at the strokes and I'm standing up the whole time. So when I thought I don't feel like making dinner, I realized that that's definitely laziness because I was not too lazy to paint today. So, I was able to like take that moment and get honest with myself and recognize that um, that difference between the two. That sometimes I can't make dinner because I need to just stay horizontal. And other times I'm lazy and it's difficult to figure out which is which. When my daughter, Bailey, you have met her, when my daughter comes home, we often will say, like, she'll come home and she'll, like, maybe, no, if, I don't think she listens to the podcast, but if she is, no offense, Bailey. So maybe she'll leave a dish or 20 in the sink, or she'll have a glass that she used and leave it in her bedroom, or when she leaves after the weekend here, the whole room will be in disarray that she was in rather than leaving it the way that she found it. So my husband and I will say, okay, Bailey needs to be realigned. That's what we say. She hates when we say that. She gets actually angry when we say that. So I have stopped saying it. But this is what it means when I want to realign Bailey, it means that her behavior has misaligned with her values and for lack of a better word, goals. Like she always is a rule follower. I mean, that's how I see her. Maybe when I'm not looking, she's breaking the law all over the place. I don't know. But she's a rule follower and she always has been. So she went off to college. This is what happened if you have a kid that's going off to college. This is what happens. They figure out I don't have anybody that's going to tell me to do anything. And I can do whatever I want. And then they come back from college and they're like, well, I don't have to do, like, I'm an adult now. I don't have to do any of these things. Well, guess what? You still do. You come home, you live, you're under our roof. Like, you have to still do the rules, follow the rules. So we have to align her behavior with what our expectations are of her. So let's think of it as those being goals. So, this realignment is if I don't know I'm misaligned, then how do I know I need to be realigned, right? Um, if I go off long enough from being on the beam, if you will, that's what we call it in sobriety. If I go off, I'm not going to meetings, I'm not calling my sponsor, which I haven't called my sponsor in a week, so I need to call her today. If I stop doing these things, then I'm going to veer off. And I'm no longer going to be aligned. My behavior is no longer aligned with my goals. And when I'm in stroke and vestibular recovery, there are times like the Easter holiday when everybody comes and visits, and I am not exactly following what I know to be best for my recovery. Meaning like getting excited. We're doing things I wouldn't normally do. Like, for example, walking down with Bailey to the beach, and we spent like 3 hours down by the beach and um, doing things like this. And so when everybody leaves, I find not only am I severely symptomatic, but I am misaligned. My behavior has has strayed from what is best for me in recovery. So I'm feeding the chaos, with maybe not even knowing it. So when I want to bridge that gap, I can stop, I can pause. The answer is always pause. I should just call this podcast pause. So I need to pause and say, what do I want and what am I doing? So what I ran across is that our goals are who we want to be, and our behavior is how we're going to get there. So I can forget on a daily basis, even an hourly basis, sometimes weekly basis. Like I can spend a whole week not aligned towards my goals, and my behavior is bad for me. I become more symptomatic, and it can last a whole week until I realize, like, I'm in bed and I'm like, what am I doing to myself? Because I start thinking, well, I don't want to be, I don't want to have to take care of myself in this way. I want to be able to watch TV. I want to be able to do these things. And I have to stop and think, okay, what do you want to be? Well, I want to feel okay. What is my goal? Is it realistic? And how do I get there? Um, I have to do that on a daily basis, and I don't, but if I do it on a daily basis, small daily alignment, then I don't have to do this big overhaul, which for me, after the Easter holiday, that's what happens. Like I'm in bed for days, and I have been. Today's the first day that I haven't taken a nap. It's 3:33 in the afternoon right now, and I definitely feel extremely tired, extremely tired. But I wanted to paint, right? I wanted to do these things. Are they realistic? The painting was realistic. Doing the podcast, I think it's catching up with me as I'm sitting here and trying to stay focused on what I'm talking about, and which is questionable, but staying focused on what I'm talking about. And I tend to move my eyes around a lot in order to, I don't know, it's part of my thinking process. My eyes have to move. So this goal right now is probably taking me off, like I'm misaligned by doing this. Um, so when I get off from recording, I'll need to rest again. Because one phone call, one walk with my dog, one glance at the TV, it can all throw me off of alignment. And those of you who have a vestibular disorder know what I mean by that. That it takes one small bad choice to throw me completely off and become symptomatic for like hours, for a couple hours. So um, the realignment needs to happen um, daily. I think it needs to happen at least at least 3 times a day for me. What am I going to do in the morning? Um, I make a decision right around noon or so. What am I going to do in the afternoon? And I was going to take a nap actually today, but you might laugh at this. I had I keep forgetting what it's called, artichoke. I had an artichoke steaming on the stove, and I had to stay awake in order to wait for that to be done. And then after I ate that, I was like, maybe I'll sit outside with the dogs. So I did that for like 15 minutes, and then I thought, I think I'm going to paint, which it's so hard for me to get in front of the canvas. It just, for some reason, it seems overwhelming to me. I mean, it is a canvas that's about as wide as my arms. So it was kind of a lot. That was not a realistic goal for me to paint this big, gigantic canvas. Anyway, looking back at my goal is who I want to be, and my behavior is how to get there. So, stop saying I'm trying to do something. Like, um, a couple things. I'm writing a book. Instead of saying I'm trying to write a book, I'm saying I'm writing a book because that is my goal. That's who I want to be. I want to be an author. So I joined the Authors Club and I am writing a book. I no longer say I am trying to write a book. So my behavior is following that identity that I've set for myself. I say a lot of times I'm trying to. I'm trying to paint a picture. I'm trying to, I don't know, what else? I'm trying to cook dinner tonight. Like, either you are or you aren't. Like, stop saying that you're trying. And once you can at least make that confident commitment to the goal, then your behavior can follow that identity. And it's it's not about like beating yourself up. So I I'm writing the book, okay? I started really applying some time every day to writing this book until it set me back. Symptom wise, it started setting me back. And then I started questioning my goal. And I started kind of beating myself up about, is this really, can you really do this? And I realized that I don't want to change the goal. The goal is realistic. There's just a lot of conditions, is that the right word? That have to be met in order for me to write. Like I can't I can't expect myself to be able to do more than write. I was like writing in the morning, writing in the evening, and then taking Autumn for a walk and expecting to be able to like sew a quilt and make dinner. And I can't do all of that stuff. So I just need to notice and adjust. So that felt like a bit of a slip up. It felt like I was setting myself up for failure. But when I allowed myself to sit for a little bit and realize like I'm not trying to write the book. I am writing the book. And my body is giving me feedback on how frequently I was sitting down and writing the book. That's all it was. My body was telling me you can't do it this much. So the payoff is that I get to keep writing the book. Um, and there's a bit of peace that comes also from recognizing that my behavior, although it's working towards the goal, it was being obstructed by my chronic pain, by my condition. So I need to work with those things. So this brings me back to what I started in the beginning. Like, how do I know when to change the goal and when to change the behavior when the obstruction is my disability? Um, and for me, it always seems to come down to slowing down. Like, my behavior shows who I am. My behavior aligns with my goal of who I want to be. So they're matched. But I've got this recovery thing that I have to always keep in focus. And I think what that means for me today is that I need to check in more often. Like I was saying, I check in with myself like 3 times a day. What am I going to do in the morning? So I'm sitting in my AA meeting. I know I'm doing that in the morning. So that's just a given. So during that time, I think about what do I have the energy to do this morning? What do I want to do in the afternoon that will, and what can I do in the morning to set myself up for being able to do that in the afternoon? Um, but I think, so before I was about to jump ahead. So checking in with myself in the morning. Lunch is another I'm starting to lose words. Lunch is another thing that happens every day, consistent thing that happens every day. So I check in again. What am I going to do after lunch? And then in the evenings, usually my last check in because, like today, I have AA in person tonight, and I really want to go to that. So making sure what I'm doing this afternoon sets me up for being able to go this evening. So when I stop recording, I might just lay down for just a little bit, just to make sure that I don't push myself too far and not be able to go to my AA meeting tonight because it's in person and I like to I like to be around people every now and then. I think most importantly, though, in all of this is to make sure that as you're checking in with yourself, like celebrate who you are now. Like I'm talking a lot about who you want to be and how you're going to get there, but don't forget to celebrate who you are now. Someone who is showing up for a podcast like this and is someone who wants to better yourself. So you're choosing to be here, choosing to consider what goals I have and how I'm going to get there. I mean, that's an amazing thing to celebrate. There's a lot of people in this world who are not thinking about who they want to be and how to get there. And so if you're dealing with chronic pain or disability or you're in sobriety, any of these things, to actually be going that extra step and figuring out, okay, now that I am sober or now that I am in recovery, what is my next goal and what behavior is going to get me there is something to be celebrated for sure. Um, so that's it. That's all I have today. Hopefully that was just profound for all of you. Anyway, thanks for coming, and I will talk to you next time.